Good afternoon. This is Dr. Robinson. We're here for our second of our Shen informational meetings. However, it's actually not our second meeting. One of the things I just wanted to say as we get started here is that please type your questions in the chat. However, if in order to ensure that we're not spending time answering questions that's already presented, if you don't mind, wait until after the presentation and then start posing your questions because we are trying to address as many questions that we've already received via the presentation. So we'll present about 30 minutes or so, and then following the presentation, we'll have a Q&A session to address questions that may not have already been answered or questions that lend to further clarification. Again, just wanted to highlight a couple of things that ensure that people understand that as we are planning for in-person and completely virtual, it's important for people to know that right now, both of those things will be different from prior to March 13th. And that's a reality of the COVID-19 period that we're all functioning in. I'm sure your jobs are different. And in the same way your jobs and your lives are different, our school provisions are different. And we're certainly trying our best here at Shen to evolve with changing needs and meet the various demands of our students, the various demands of the state agencies that regulate what we do. But more importantly, to ensure that we do continue to focus on providing a quality education experience for our students and a safe experience for our students. So I think those things are absolutely important for all of us to know. We've had many sessions over the last month and a half discussing our reopening plan. We had surveys, we've had a webpage developed that has a ton of information. I would strongly encourage people to, if you haven't looked already, go to the reopening page. There's a extensive FAQ document on that page that addresses many questions. We have links in our reopening document that links directly to the New York State Department of Health documentation, to the New York State Education documents, and those are all the documents that we have used to develop the plan that we have had, that we have right now, and the plan that's continued to evolve as more information come about. And again, on the screen, you'll see a lot of live stream sessions that we've already had. Last week, we had one on the CVL, a completely virtual learning session. And tonight, we'll be doing one on safety PPE, contact tracing. Tomorrow afternoon, we'll be here again to talk about food service and transportation. And then on Wednesday, we'll be here to talk about instructional programs and logistics surrounding those type things. The point I'm making is that our goal is to ensure that we are being as transparent as possible, putting information out there forward-facing so the public can see it. The same information you're seeing is all the information we have. It's not like we have secret information that we're not sharing. As things are developed and modified, we're trying to put information out there so people remain informed. So the purpose of today is, as I said before, is an overview of some of our safety protocols. Particularly, we're going to focus probably more so on the side of contact tracing, on health services and some of those provisions, because we know that those are some of the common questions people have. And again, with this presentation, we would look to address what we're calling some of the more common or frequently asked questions that people have. So just to kind of give you some sense of where we're going is that we're going to be talking about the things that we're doing to promote certain behaviors to reduce the spread of COVID-19. We're going to talk about the things that we're doing to maintain a healthy environment here at school. And also even hints about what parents could do at home to preserve a healthy environment. We're going to talk about contact tracing and the work that we're doing with the Saratoga County Health Department. We're going to talk about social and emotional well-being, the things that we're doing to help students transition back to the school environment, as well as how we are trying to help, or should I say how we will help parents support their children at home as well, recognizing that the social and emotional piece is one of those areas that we know it exists, but sometimes it manifests differently with different students. And so how can we as a system be supportive of those initiatives? And then, as I said, we have some opportunity for questions. So joining me this afternoon is Rebecca Carmen. And Rebecca serves several different roles in the school district, but specifically related to our opening plan, we had to designate someone to serve as our COVID-19 coordinator or liaison. So part of her role is not only liaison with our nurses, with our school physician, but she's also liaison directly with the Saratoga County Health Department and as necessary with the New York State Health Department. And that's important. It's important for us to have one person who's a point person. That way we know that information is coming to us is accurate, it's timely, and it avoids confusion. So that's a huge task that Ms. Carmen takes on here for the district, and one that I know she takes extremely seriously because we take the safety of our students, the safety of our staff extremely seriously. So Mrs. Carmen is going to walk through several slides, again, highlighting some of the things that we have heard many people want to know more about. And at the end, we'll engage in some Q&A based upon questions that people submit into the chat. So Mrs. Carmen.
Thank you, Dr. Robinson. Good evening, everyone, and thank you again for being here tonight. And we are hoping to answer many of your questions. As Dr. Robinson said, we are constantly looking at how we can prevent and mitigate the risk with related to COVID-19. So we are constantly looking at strategies across the district, first being our daily screening. Every day staff are self-certifying to ensure that they don't have any signs or symptoms. And if they do, we have a very detailed process on the steps that they take regarding that if they self-certify yes. In addition, we're looking at students and how are we screening students, and we are in the process of working on developing a process for that, and more details will come when that process has been fully developed. In addition, we've been doing trainings for quite some time, actually. As soon as this started coming out, all of us are engaged in trainings on a regular basis on how we can become more informed. Our staff are required to take the online training prior to the start of school in the areas of hand hygiene protocols, taking videos regarding face coverings and how do you wear them, how do you care for them and properly wash them, respiratory hygiene protocols, as well as being able to identify those symptoms of COVID-19. When we talk about PPE, personal protective equipment, that is one area that everyone is really wondering about, and students and staff and visitors to our schools are absolutely expected to wear face coverings, including when they're inside the building as well as outside. School bus is also where they should be wearing it. We know that there's going to be times where students are going to be allowed to remove those face coverings, times when they're eating, and also when they're able to properly social distance, they'll be able to do that. In addition, we know that there are some students who are going to have physical or mental impairments who aren't able to wear them, and we will work through those individual circumstances as they arise. And we have face coverings. We all have many different kinds, many different types. As a system, we are supplying those to our students and our staff so that we know that at a minimum, everybody has one mask that they can wear. When we talk about cleaning and disinfecting, that's one area that we are definitely ahead of the game, and we look at the supplies that we're able to offer across the district in our classrooms, in our offices, and we are going to have soap, hand sanitizer, which is at least 60% alcohol-based, paper towels, tissues, wipes, so that they're available in the classroom as needed when areas need to be frequently cleaned. In addition, we know that our custodial staff have been working, on an ongoing basis to make sure that they are frequently washing those frequently touched spaces and objects, those surfaces, and they will continue doing that when school is in session. Our bathrooms are maintained on an hourly basis, as well as our offices are at a minimum on a daily basis, sometimes more, and the hallways will be swept and mopped as needed minimally twice a day. And again, it's a very rigorous process. In addition, we look at the filtration and ventilation system. We have worked with engineers. We have followed the Department of Health guidelines in regards to the established proper protocols to ensure that we have the correct filtration requirements and ventilation. It's about getting fresh air in and opening the doors and windows while maintaining the safety and security of our buildings. One of the major areas that we are constantly looking at is signage and messaging. How are we providing appropriate messaging? Where are we providing it? And how are we communicating that out? We have provided many signs across the district in regards to promoting just proactive measures, the hand washing, how to stop the spread, proper use of the personal protective equipment, making sure that you're wearing your mask, adherence to social distancing instructions, as well as posting the symptoms of COVID-19, which those you will find at every entryway across the district, at every building, to ensure that it's a self-check, again, before people are allowed into the buildings. The nursing department will publish a quarterly newsletter, which will also provide additional resources and information for families. the health and safety plan that we have posted in the reopening plan, there's a link here that you can go on and look at the health services plan in more detail, and you can also find it on the district's website. So contact tracing is an area that is really important, and right now it's on the forefront, and a lot of questions have been brought up regarding this. And as Dr. Robinson said, I am the COVID coordinator and work directly with the Department of Health. Our nurses here in the district are in the process of finishing this training. It's a 6-hour training, and I myself am also in the process of finishing it. And we're working with the Department of Health so we can really ensure that we can quickly locate and talk to the individuals who have been in contact with or had contact with somebody who has tested positive. There is a New York State contact tracing number, and that number, when people call, a lot of people hang up because they don't recognize the number, and it's really important, and we put that here tonight, so it's a reminder for people to take a look at that number. When you see that, please pick up your phone. It's really important because the Department of Health is going to ask some questions regarding contact tracing. And again, safety is everyone's responsibility, and we all have a part in that. Currently, we have established district protocols for contact tracing. We have implemented the formal process in collaboration with the Department of Health, and I have direct contact with them on an ongoing basis. We have to make sure that we are ensuring accurate attendance records for students as well as for staff members. We're ensuring student schedules are up to date so we know where students are, and at every building, the visitors and or staff entering those buildings have to sign in with the date and the time and where they're going. And again, that's for contact tracing purposes and accountability for safety. So what can a staff member or a student who is diagnosed with COVID-19 expect happen during this process if in contact tracing? If you are diagnosed with COVID-19 and you have a positive case, you would get in contact with myself and or your building supervisor here in the district, and then we would go through our formal process that we have in working with the Department of Health to ensure that we are, again, mitigating that risk of COVID-19, and we would be looking at those records in the building, and we would also take that guidance from the Department of Health as to what next steps we need to follow. Is it self-isolation? Does the employee and or student need to be sent home? And or is it quarantining? And once we provide Department of Health the necessary information, they take over and they would work with staff and students families directly. The other goal that we wanted to address tonight was the social emotional well-being of our staff and our students. We know that during this time that students and staff have been out, the needs of our staff and students in regards to social emotional wellness need to be addressed. We have many resources, and we have provided a link here for you for mental health supports. In addition, we have our student support counselors, our counselors, other related service providers such as psychologists, social workers, that are all available to every student. They could see them in person as well as for individuals who have chosen the virtual option. In addition, they can reach these individuals by email, by phone, or in person in their specific building office. The website offers a wide variety of information as well as outside resources if resources in-house aren't available. In developing our reopening plan, we also have spent a lot of time talking about the social emotional well-being and developing an advisory council, which that advisory council has formulated the comprehensive development of a student-focused plan, social emotional plan. That plan outlines what curriculum and what lessons could be taught, in addition to what resources are available for our staff, and we continue to expand upon that and provide additional professional development for our staff and our students in this area, also including our culturally responsive instruction.
So thank you very much, Mrs. Carmen, for that overview. So at this point, I noticed, I'm looking at my computer here, we starting to have questions coming into the chat box, and we would like to start to address some of those questions. Recognizing some questions will go into more detail than others. So we would start, and I'm just going to actually just start from a question that came through in terms of bathrooms. One of the things we're in the process right now, working with our facilities, is combination of things, recognizing that we must, by regulation, have certain bathrooms available for student use based upon the number of students and the capacity. So that's not necessarily an optional piece of it. The piece that we're in the process now of developing plans to ensure that we don't have too many students in the bathroom at the same time. The same expectation carries through in terms of wearing a mask in the bathrooms, of also telling kids, yes, unfortunately, in the past, sometimes kids went to the bathroom not because they wanted to go to the bathroom, because they wanted to socialize. This is a new day. You'll be going to the bathroom because you actually need to use the bathroom and not as a social venue. And so that's going to be one of the expectations. It's going to be outlined very clearly to students and monitored as well by our staff to making sure that students are adhering to those type things, because we certainly don't want to ever be in a situation that we deny a young person the opportunity to go to the bathroom, but we certainly have those protocols in place to make sure that those things are in place. It's no different than when teachers have to say, if you have multiple kids want to go to the bathroom at the same time, we have to have established protocols to make sure, again, that we're not going from a socially distanced environment to one where we have a large number of students congregating in the same place. And our bathrooms, quite frankly, are limited to a certain number of students anyway. And most bathrooms are separated by, we have bathroom separations. And so therefore, that's not necessary. Bathrooms right now is not our biggest concern, quite frankly, because of how the bathrooms function and our expectations in terms of monitoring those areas. Mr. Carmen, you want to offer more on that?
Yeah. Also, in regard, somebody had asked about the cleaning of the bathrooms. I mean, we have a huge district. Some of our buildings are very big, and the question was, how are you going to get to all those bathrooms within one building? Our facilities director of facilities and operations has worked endlessly, working with custodians and building capacity around that, and even looking to increase staffing to ensure that we're meeting the needs of our staff and students during the school day. So there will be increased staff during those hours to assist with those cleanings.
Another question that came up, and this is one that's come up more commonly. So, in terms of if a child is showing, be it a fever or cough, something that's not necessarily a COVID symptom, even in our certification, it asks if you could explain it. I'm going to give myself personally. Personally, I have certain seasonal allergies that cause me to sneeze, in particular if I don't take the allergy medicine early enough. But I know that's a condition that I have. And however, it's something that's unexplained, we would ask people to see a medical provider. This is not an absolute, if you have one of these symptoms, thou must go and take a test. That's not the case at all. The health department is very clear about that piece of it in terms of people making sure that they understand their health needs and first communicate with their respective health providers. And if necessary, communicate with us, and we can communicate with the health department to do some follow-up and follow-through on that as well. So I think that's an important question that people ask. But the bottom line is, prior to even COVID-19, the standard piece is if you as an employee or your child is feeling sick, stay home. And even more so now, if you're feeling sick, stay home until you can get a further handle on identifying what's the source of that symptom or that illness. Mrs. Carmen, you want to contribute to that?
Yeah, in regards also to when students or staff are feeling ill, and it's outlined in the health services plan, we do have a well area as well as an isolated area in all the nurses' office that are designated. So when kids are sick, they can go to those specific designated areas, and the nurses can assess and triage as needed and work with the family to determine what is the best course of action. But as Dr. Robinson said, our recommendation and what Department of Health is requiring is you contact your primary care provider.
There are, again, some questions that people ask, and we just wanted to reiterate that the expectation is that when you're within a school building or school facility, you'll be wearing a mask. There will be situations, for instance, if we're doing social distancing in the outside environment, of children having to take the mask off. But all those situations will be reviewed closely, again, from the lens of making sure that we're being safe first as we move forward. And so if there's situations that we need to look closer, we will. But that is the expectation as we move forward. A couple questions came up related to, and Mrs. Carmen addressed it, about contact tracing and quarantining. As a school district, we cannot tell someone to quarantine. That's a responsibility with the Saratoga Health Department, and they have been great working with the school district with our processes. And Mrs. Carmen, as a key point of contact, will work with them and work with the families to make sure that everyone is on the same page, and also to try to isolate and identify potentially impacted parties or people who may have been potentially exposed, and making sure that we can limit that. And that's the reason why, even in our planning process, we're trying to stick to more of a cohort model so we know where students are, minimizing transitions as much as we possibly can throughout the building. So again, if there's a case, we can quickly go back and identify where that case could have occurred and those individuals that who could have been in contact with. Just quickly, just scanning through the questions again, making sure that we're not addressing things that people may have asked.
Students who cannot wear a mask
Yeah,
be
so
required to wear a shield.
that's one. And again, we do have, and we were fortunate this summer in some ways because we had the extended year program for some of our special education students and we had some students who could not wear masks, and we had to look at those special circumstances and how do we address that with different type of PPEs. And it's no different now as we go into the school year. If we have that situation for certain students, we already know because of our experiences this summer, and so we have a plan for those students. And if we have situations for whatever reason, those are conversations that the respective building principal and or nurse and or counselor will have with those families and students to make sure that we understand what's going on and ensure that we not only the best protection and safety for that student, but also the best protection and safety for all other students. So again, we'll deal with those situational, those examples as based upon circumstances, and deal with exceptions as exceptions. But the norm is students will be wearing a mask. In some cases, we even have teachers who have already requested to have a mask and a shield over the top, based upon one, some cases what they're doing, their functions that they have. And I say teachers, could be any employees, to be frank with you. And so we're looking at those as well as a school district. We have enough PPEs that we can offer our employees in those situations, and certainly for those exceptional cases for students as well.
Cleaning products.
The questions about cleaning products, we are very cognizant of the New York State DOH standards when it comes to student handling or using certain products. And we also know that we want to make sure that we have, as Mrs. Carmen pointed out, wipes and certain cleaners with a percentage of alcohol base readily available for adults, employees to use to wipe down what we call frequently. Such as myself, I have on my desk a wipe that I used to wipe on my computer and things of that nature. I wouldn't expect that the custodian who's going to come in the afternoon is going to come in and wipe down my desk for me, my computer. That's something that I frequently touch and frequently use and wipe for myself all the time. However, we are structuring our custodial staff, as I mentioned before, to have people around to make sure that we are sanitizing and disinfecting as much as possible, and holding people responsible. I mean, hand washing is a huge part of the protocol as well. So we want to make sure that those hygiene standards are kept very stringent. And again, a lot of it is we know families are doing it right now, and we hope that those same good behaviors will continue in the school environment. But most importantly, we're just not going to bank on hope. We're going to be, quite frankly, monitoring those things very closely because safety is an absolutely important piece of it. And when we have situations where, be it a student or staff say, well, I don't want to wear a mask. Well, you know what? At that point, it's a conversation, if it's a student, with your parents, to no different than if there's a violation of the code of conduct right now. You need to come to the school and we need to have a conversation about how to ensure that your child is following the rules and regulation. If it's a staff, it's no different than any other code of conduct from an adult perspective violation right now, that we need to have a conversation in terms of what expectations are and how we ensure it. But again, we're not building this plan with the assumption that most people won't, because quite frankly with you, we're fortunate that most people follow most rules all the time, and they have. This is not a new thing. We're required right now to all wear masks in public, and we're fortunate that most people in this region have been, and we'll continue to uphold those same high standards as schools reopen. A question about removing masks, doing portions of instruction under the guidance of faculty. How would that be like? Well, again, one of the things that social distancing is a two-part fold. wearing a mask and an appropriate social distancing. And when we have both those things, should I say, there will be no relaxation of a mask break without appropriate social distancing, period. And so those will be situational. In some cases, I mean, at the elementary level, it could be when kids go out for a recess time and they're social distancing outdoors. Even at the secondary level, we're in the process right now of cleaning up courtyards and other fields, outdoor areas, or even within a large classroom space where appropriate social distancing can occur, where kids know that this is a mask break. It's not a time to congregate and get together and talk. It's a time where, quite frank with you, we have a break from that piece of it as well. And so we want to be reasonable in how we do it. When I say reasonable, not so rigid that everyone has to take a mask break at the same time. Bell rings, mask break time. That's not going to be the case because we know that different classroom situations are different. And if we have a unique situation where a child, because of some type of pre-existing condition, need to have a break more frequently, we'll make those arrangements. And if it's something that we have to coordinate with our nurses, so be it. So we look at those things, again, those unique situations as unique situations.
There's several questions regarding social distancing, and we do have the classroom set up with the six feet minimum of distance in between staff and the teacher and students, as well as the students. In addition, a lot more questions regarding cleaning and hand sanitizing, and those products are available in the classrooms, and what isn't physically in the classrooms will be in the classrooms when students return. We know that that's very important. When we talk about cleaning the classrooms, between the classroom teacher as well as the custodian, again, physically, when they're able to get in the classrooms, they'll clean them, but the teachers will be responsible for some of their space also. It's not the kids, they may be looking at their own desk or have their hand sanitizer on their desk that they can use if they're not able to physically wash their hands during specific times also.
A question that comes up is the health screening for students, and we are in the process of developing any app that we develop. It will be mobile based. I do my health screening every morning around 5 o'clock, 5:30 in the morning on my phone. And so the app that we are using now is actually something we developed internally that we use this summer. However, recognizing the scale, to scale it out, we're looking at a more commercial app that hopefully within the next week here we'll have that ready and having people trained up, and also create a video that we could share with not only staff and students and families and how to effectively do so. And that's like the first feel, right, where people taking the responsibility to make sure those things are in place. We will be doing periodic temperature checks, and certainly if a child is not feeling well or staff is not feeling well, we'll be engaging those protocols from the health pieces. But we will be doing some periodic pieces. We'll be doing the follow-ups if we see families or whatever, a day goes by, a child didn't do the health screening, we'll be following up with their family. Yesterday, the health screening didn't occur. In fact, the app that we're working on now is something that if it works as the vendor described, it not only comes to us in a aggregate, but we also get that information from a teacher perspective, so we'll be able to know period by period who has or who hasn't, and do the necessary follow-up as we need to. So that's where the technology, and people have to remember, a lot of this is technology is being developed right now because it's the first time ever we've ever needed this technology. So we're watching to see what's actually good and workable, and not necessarily what people say is good and workable. So we're actually looking at some apps that some school districts that have already reopened are using, and how effectively those things can be used for us as we look to scale it out here at Shen. Music classes is one that came up. It comes up quite often. And basically, I would put that in the function of all performing arts. And right now, the New York State DOH regs is 12 feet distance. And I know that our music staff and the New York State Music Association, they have put together a pretty comprehensive plan in terms of how some of these things can occur. And so we will continue to look at that, again, driven by the notion of safety. So as we stand right now, that's one area. Performing arts is one area that if there's a question mark, it's still a question mark in terms of how and when and how frequently we'll be providing those course options to students. And so that is one of those that's still very much on the table to be determined and defined as we move forward, because our focus, and again, this is about safety and PPE, but our focus has been largely ensuring those core courses are available for us as we move forward.
Dr. Robinson, there's several questions regarding lunch and, is it going to be in the cafeteria? And I know we have a presentation this week regarding that. Lunches are served in the classroom and will be in the classroom.
In some cases.
Yeah.
Both. So lunch will be in a combination of in the cafeteria as well as in classrooms. And tomorrow we'll be having a conversation with Katie Headwell on food services. But for those who may not tune in just for that piece of it, right now, again, everything comes back to that simple premise. How can we do all these things safely? And so we got to look at how food is served and what type of food and prepackaged meals versus sharing of meals or serving of meals coming through a line. That's not going to be the option. And so those kind of things that we're in the process of fine-tuning those protocols right now as we speak. Notification about families of positive cases. You want to talk to Mr. Carmen?
Sure. So our protocol in working with whether it's the flu, H1N1, or the COVID-19 is pretty much the same in regards to that. When we have a positive case, we have communication. Our public information officer will be sending out communication as she normally does in regards to that we have a positive case. No specifics. It's very confidential. Will be provided except that we've had the positive case. In regards to those who would be notified otherwise, those who have direct contact with that individual who's positive are the ones who would be notified. If it's a classroom, for example, the classroom teacher would be notified and potentially all the students in the classroom, or maybe ones that are in close proximity of that individual. Again, that's a determination that the Department of Health makes based on the information that we provide them as a system. So again, we provide the information to Department of Health and they will guide us through the process and tell us what we need to do or who that they're going to be contacting if there's a positive case.
Just a couple comments that came out on filtration. This is actually spelled out pretty clearly in our Q&A document, as well as our reopening plan on the section that talks about filtration. The state came out, particularly when the governor was looking to open malls and required what they call a MERV 8 filter. Minimally, all our filtration systems have MERV 8. We actually go up to, I think, maybe 13 based upon. So filtration and the size of the system. I'm not an engineer. That's the reason why we've asked our engineers to look at our entire systems, to look at filtration as well as ventilation, the combination of the two things. And ensuring that we have the appropriate filtration filters and the ventilation airflow for the spaces, recognizing what's in a classroom is going to be different than what's in a gymnasium, for example. So those things will vary as we move forward. So we're in the process of doing that. And for some areas that we have some areas that are designed to be singular offices, and the expectation is that they're going to remain singular offices, because the ventilation in some of those smaller areas necessarily equipped for that. So we certainly want to monitor those areas very closely as we move forward. In fact, that's a big thing that we're doing this week, is actually going through all those ventilation, all those filtration systems, and making sure that what needs to be repaired is repaired appropriately, what needs to be modified is modified appropriately, so that once we have school opening, we'll be ready to go. And making also the difference between now, September, October, when the weather is fairly warm, versus when we get into January, February. Quite frankly, I hope that January, February, we will be having this conversation. But the reality of it is we have to plan for that as well. So we're in the process of going through those pretty extensively right now this week, for a matter of fact.
Again, a lot of questions regarding the masks and, have we looked at the updated research and so on and so forth regarding masks. And Dr. Robinson has said this over and over in regards to COVID-19. It's a fluid situation. Things are constantly changing. And as a system, we will pivot when we need to pivot. And when we're provided guidance from the Department of Health and or CDC or SED in regards to masks, we would absolutely pivot. Right now, we know what we know about masks.
Water is a question that's coming up quite a bit. We will be encouraging parents to have children bring their own water bottles. And we have, in fact, modified several water fountains to become fillable. You fill your water bottle so you're not necessarily touching anything, touchless. And so we're in the process of providing that. And worst case scenario, if we have a situation where a child is in need of water, we'll certainly be it through nurse's office and through coordination with our food service try to get that. However, we will be encouraging parents to have their children bring either a bottle of water or, like I have on my desk, a tall container with water that lasts me throughout the day as well. So a lot of that information will be coming out from building principals as a part of their opening correspondences to parents in the coming week. Again, just want to look through some of these questions as they're coming in.
There's a few questions, Dr. Robinson. I think this would be great. And I thought people did a really nice job of asking this is when a sibling who is maybe in another school or daycare or whomever has to quarantine, and then they tell the sibling that is coming to Shen that they have to quarantine, what are their options for learning? So can they jump on the CVL, or how are we adjusting that?
So and I'm just going to make this distinction in the sense that the completely virtual learning option is going to be more structured for a cohort of kids with a classroom. So the question is, if a child is quarantined for 14 days, we will look to provide virtually the educational provisions. I'm making a distinction between the CVL because it's not necessarily opt into it. You may very well opt into a CVL course, but it's about the largest sentiments of we providing educational virtually for when a child either being self-quarantined because recommendation from the health department or physician, and or officially quarantined because of a known COVID case. So virtual optioning will become important as well as we move forward. Question about if a child or someone is noticed to be sick during the day. Yes, it's the same expectation. If a teacher or staff member notices that a child is showing certain symptoms, yes, absolutely send them to the nurse. We'd rather err on the side of being incorrect that the person didn't have anything than otherwise. So we absolutely encourage that. And Mrs. Carmen pointed out, we have if you go to your pediatrician now, you have the sick area and the well area. We have an area that for those situations that we want to contain to make sure we make an assessment of the situation. If necessary, call the family to pick up the child immediately from school, or have the child wait there until the family is able to do so. Again, I'm just trying to scan through, make sure we're not repeating the same questions. And so someone asked about the notification. So if we have a case at the high school, as Mrs. Carmen pointed out, the first instance would be on those who could be impacted most immediately, who are closest to the potential case. And yes, we send out communication so if people are aware, because sometimes we may know there might be other connections outside. But one of the things that we will not do is violate someone's privacy and say this person, that person. That's not going to occur. The only individuals who will know names will be the health department as they go through their contact tracing sequences of events as well.
Dr. Robinson, excuse me, there's a lot of questions regarding testing that we have here, and we know we can't randomly test students. So I don't know if we.
So that's a question that came out, and unfortunately, I think it was a misstatement by the governor, because they came out with a correction several days later. But we know what the news will run the first statement, but not necessarily the correction as well. And it was a misstatement. I'm calling it a misstatement. I'm not sure if the governor will call it a misstatement. So for those who are going to call the governor, say the superintendent of Shen said that he made a misstatement. But there was a correction that came out by the New York State Department of Health, that talks about if there's a confirmed case, that there needs to be a test before a person returns. That's where our communication with the health department comes into place, and it becomes the department's responsibility to make that determination with the family. So as a school district, we are not testing facilities for COVID-19. We're not authorized to do testing. We're not equipped to do testing. All our coordination goes through the Saratoga Health Department, and they will manage that based upon the unique situation, based upon the circumstances of a particular case. Again, just kind of so people asking about reopening videos. Our goal is, and not only as a district, but at the building level, there'll be various videos. I know Mrs. Carmen and her staff already did a video on how to properly wear your PPEs as well. So, and there are tons of videos right now on YouTube related to everything, how to clean it, how to disinfect it. So we'll be doing a variety of different videos, some of them that we create, a lot of them that we'll be able to download from other sources as well, and share those resources out with families as we continue, not only as we get closer to reopening, but as we go through the school year, as a constant reminder of folks of best practices. So this question about recess on Wednesday, we'll be talking about programming. And yes, the elementary principals are in the process now of fine tuning the elementary schedule, and there's a recess portion of it. At this point, I don't have the specifics on as I'm sitting here, because I know that's something that they're in the process now. And on Wednesday, we'll be talking about that. But more importantly, that will be also part of the communication that will be coming out from individual buildings and principals. So those are the type of questions that are unique to buildings that people tell you, what does recess look like at Scano versus Chango? And so those are the type of things that principals will be articulating that information to parents, as they have normally do during a normal school year, as a part of their reopening process.
So there's questions about school safety that we have. A few of them will doors remain locked? Doors are always remain locked and currently will remain locked to ensure that we're in compliance with the guidelines that we have to comply with in regards to school safety. As I said, we're looking at opening windows to increase the airflow, and the cleaning of the rooms, and as we continue to work in these spaces, there's a lot of questions, Dr. Robinson, about, who's cleaning the desk, students aren't going to be physically cleaning the desks in the room. However, they may choose to wipe down their desk if that's their choice. However, the teachers in the classroom, as well as the custodial staff in the buildings, will be responsible for cleaning down those areas, throughout the day. Did you want to add anything more to that?
No, that's fine. I'm just looking at the questions. Someone asked about the cohort. Certainly, the cohort model works. It's neater, if you will, at elementary versus secondary, where kids will change classes. And even so, that's the reason why we're going towards, and again, this will be addressed on Wednesday. We're at a secondary level, we're looking at the block schedule more so to cut down on transition. So instead of kids transitioning 9 times throughout the course of the day, they'll be transitioning 3, maybe 4 times. And so consequently, we'll know where blocks of kids are at different points and who they're interacting with at different points. And also there'll be some staggering between transition, again, to avoid the large crowds in hallways and things of that nature as well. So some of those will be addressed more so, but it is part of our safety protocols. Premises on the simple fact that we're trying to minimize large groups of people in any space, period. That's why locker rooms, we will not have locker rooms accessible, because large groups of people. And so how do we provide physical education? Physical education will provide it significantly differently than it has in the past. And so that's also be integrated in classrooms. Some of it could be quite frank with you, from a virtual perspective, but we're certainly going to minimize those situations where we have large groups of people anywhere, be it hallways, be it lobbies, be it in cafeterias, and certainly social distancing become a big part of those things as we move forward. And to some degree, we may have to be, to some instances, use some of the gymnasium spaces for some instructional spaces, so that will minimize even the use of gymnasium for physical education. However, kudos to the physical education staff. I know that they are working on plans right now based upon that 12 feet parameter to do certain things, whatever they can, and based upon other protocols in terms of who's touching what, certain things. And so a lot of people are trying to come up with a lot of creative ways to provide some sense of normalcy for our students, however, within a very safe parameter.
Um, Many people have asked about protocols about when kids are sick and temperatures and headaches, and the nurse's office will be accessible as it always has been in the past, and again, designated areas for a well visit versus a sick visit, so that we can isolate students who are sick. In addition, each building will review that specific nurse's protocols as they are reopening and communicating out with their parents, because each office is a little bit different. Students who are sick will be escorted out of the building by the nurse to limit people coming into the building. And again, that depending on the office of the nurses will be a little bit different, because some nurses' office have 2 doors, so they're able to utilize both those doors, one for the well visit, one for the sick visit. So again, the building will communicate those individual protocols or procedures out.
And also related to nurses, our nurses here are very conscientious, and what I mean by that, they're aware of certain students who may already have certain pre-existing conditions, and so they'll know the kids who always have certain severe allergies or severe asthmas and things of that, and so working closely with those families become or should I say, continue to work closely with those families is an important part of this process as well. So back to Mrs. Carmen's role, working with nurses over the course of the summer to really, again, identifying and recognizing who are certain students that we need to be keenly aware of, and working closely with those families is a big part of this process as well. So we already have a lot of information on kids in terms of allergies, and certain kids who have certain reactions. And in many cases, a lot of those families are making different decisions as we speak. And so we continue to work with those families in the same way that we have worked with those families in the past.
There's some questions regarding transitions in the hallways with middle school and high school and social distancing.
So those I'm going to generally or generically answer the question of transitioning now, because we're going to more. With the block, there's a longer extended period of time between to create a stagger. So again, we're not having bell ring, every kid's jump out of the classroom into the hallways. Things will be staggered. So that certain number of kids in the hallways to, again, avoid those type things. We're also going to minimize, in cases, probably minimal or no access to lockers, so kids will have what they need with them, so avoiding the situation of kids stopping at lockers, and that's what often create the log jam, if you will, in some of the hallways. And so those are the protocols right now, and those will be a part of the orientation process. For instance, 6th grade orientation, 9th grade orientation that the principal will be going through with kids, and some will be on site, some will be virtual orientation, to make sure people understand what those protocols are and what the expectations are as we look to reopen in September.
I don't think I did a good job expanding upon the safety, school safety, and talking about the drills. And there was a couple questions related to fire drills and lockdowns. We are still required to have all those drills, fire drills and lockdowns. They just might look a little bit different because, again, there's certain protocols that we have to follow. And in the event of a true emergency, we're not going to worry about social distancing if we have an unfortunate situation happening. So we're going to still go through those drills and talk about what we should be doing in the event that if any of those happened. And in regards to fire drills, we'll still be conducting those. And, students obviously having their masks on and trying to maintain that social distance as we're walking outside. And one of the things that we have to do and have to think about is the fact that students are going to be here 2 days on, 2 days off. So we're going to have to do double the amount of drills to ensure that every student has had the same type of drill and background with students in regards to safety.
And it's important that as people are asking questions, we are going to refer you back to documents, because when you get off this call, you may have a question. You're going to say, what's the resource? It's important for anyone to know what the resources are at their fingertips. And so that's the reason why we make the reference, such as if more details about certain things are in a particular document, because we are doing that so you can always have a source document to go to. So that was a question that came up from someone. I want to make sure you understand it. It's not about not answering a question. It's about how do we make sure that we're equipping you as a parent with as much information as you can. So I think that's an important piece for us to emphasize. A question I just saw in here, there was one that someone said, can teachers take their class outside? The answer is generally yes, and that's with coordination within buildings, because we all of a sudden we're going to have every class outside because it creates another situation. But certainly we have had schools, many places have outdoor classrooms where they have different things where kids go outside and do certain things. And so certainly we want people to take those things under consideration as we move forward. And so, as I mentioned before, that's the reason why we're working on our courtyards, for instance, in the middle school and the high school, make sure that those places are clean and available, working at surrounding field areas by schools, be it playgrounds or otherwise. So again, people have options to do some of those more creative things throughout the course of the school day.
Question about staff and how do we utilize staff, and looking at the library and computer lab, how is that staff going to be used, or how is that going to be managed?
So again, a lot of that will be addressed tomorrow, but one of the things we're trying to maximize staff capacity to ensure that from the in-person learning experience, kids have a qualified, certified teacher in the classroom with them. And so library services. I mean, some of our librarians will be delivering lessons in classes with kids, because we won't necessarily use the library in the same traditional way as we have done in the past. So we're going to maximize those things in terms of providing lessons within classroom experiences. And so for people who have that's the session on Wednesday, where we'll be talking about some logistics. We'll have a high school principal, middle school principal, and an elementary principal here with us to walk us through some of those nuances of what does the typical day looks like. And so that will be a part of our session on Wednesday. Someone asked about having clear desk shields. We're actually looking at some of those now, particularly maybe on tables where we need to have small reading groups, for example. So we're in the process of investigating that to see what's the most feasible way to do some of those things as we move forward. So that's one of those things, particularly where we have situations where we have smaller groups and we have smaller groups of kids together in spaces. How do we have some of those clear desk shields as a possibility on a table set and things of that nature? So we're looking at some of those things as we speak. Someone asked, will we bring in Saratoga Health Department to complete random testing for COVID? That's not a question I could ask. I don't anticipate they will be coming in, because when you think about that, the parental violation piece of someone coming home, Mom, Dad, someone came and gave me a COVID test today that we didn't inform them of. Clearly, that creates another issue on itself. And so I don't necessarily anticipate random testing for COVID-19. Certainly, we have made and we will continue to make available those sites that are within the Shen district or in southern Saratoga region that you could do a COVID test. For instance, the CVS on what's
Route 140.
the one for CVS on what's the CVS that does the COVID testing?
Oh, Crescent.
For instance,
Right
the
now,
CVS
I
on
don't know.
Crescent Road, for example, just one example of this came to mind. And so I don't anticipate the Department of Health. Again, I'm saying it now today. Who knows what the requirements or the mandates might be between now and when we reopen school in the beginning of September. But those are things that, if that becomes the case, we would certainly look to help facilitate that process as much as possible.
So again, a lot of questions that are going back to the 6 foot social distancing in the classroom, as well as wearing the masks. Um, except obviously during lunch and recess, as we had talked. But
Yeah, so one of the things that, I appreciate, someone asked the questions about, saying about basically my kid can wipe the desk down when he or she
yeah.
leaves. And ideally, quite frankly, with you, that would be a great thing if, particular, if you have a child beyond probably even sixth grade or could even be even younger. However, right now, the Department of Health regulations prohibit us from asking students to do so. Right now, I say right now because, quite frankly, with you, every week seemed like what we thought were the rules, based upon past practices, may very change based because of the realities of COVID-19. And so regardless, we have within every classroom containers of sanitizer or either spray and paper towels readily available to do those type things as we move forward.
And when we look at, from a high school perspective, and in talking to the building principal there, one of the things that he's brought up is class sizes could be different from day to day, just based on the breakdown. So you could have a very small number of kids, 8 kids potentially in one class one day, versus 14 the next day. So again, social distancing is a requirement. That is something that we are absolutely expecting. And someone said, is that information going to be in the code of conduct? And, there's a couple of things that we are constantly looking at updating, but as things change, information changes. So we're kind of holding off until we are ready to go and ready to be open so that we can make some of these adjustments. But social distancing and wearing your masks are non-negotiables.
So a safety question again. Someone asked about front doors. The front doors to buildings will always remain locked, and the same protocol we have now to buzz people into the building will be the protocol. And for an example, this spring we updated the lobby area at the high school. So now, for people who might be familiar with high school, you could come into a outer vestibule, not the inner vestibule, and the security personnel booth will be there. You'll be asked for why you're here, and you have to sit in that area before you're buzzed in to go even into the internal vestibule where students are. So those safety protocols remain, and so certainly we have to balance between ensuring those safety protocols as well as the safety protocols related to COVID-19. So those safety protocols remain as well.
Dr. Robinson, we've done, this past week, we've done training, and we're starting to do additional training across the district with all of our staff that's working the front doors, and to ensure that they're all aware of the front door protocol and making sure that they're even asking the right questions in regards to screening for COVID. And as I had mentioned earlier in the presentation, at each door there will be a list of potential symptoms for COVID-19. And the person who's going to be answering the door will be asking people, if you are symptomatic. So it's a way of screening, because we obviously don't want people in the door. And we want to minimize the visitors. So each building will establish those building protocols for, if you need to drop something off, here's a table, you can drop it off. Versus if you have an appointment, we want to make sure that those appointments are scheduled to ensure, the safety of our staff and our students.
Another question related, thank you, Mrs. Carmer. Another question related to testing. Someone asked, will we as a school district require staff and teachers required to be tested prior to teaching? Right now, that's not a requirement under DOH regulations. And so the answer to that question is no. However, we require every employee every day to complete the health certification process. So the first part of that is no, and our next part of the answer is that every day everyone must complete the health certification process as we move forward. And to go back to the mask question, someone asked and was very persistent. It actually wasn't a question, was a statement. Masks should be worn 100% of the time. There will be periods of time during the day, be it during lunch or during periods of time where we designate for mask break for kids to social distance, appropriate place, appropriate time to not wear a mask as we move forward. And related to that question was will students be required to wear masks during transition in the hallways? The answer to that question is yes. They will be required to wear masks during transition time in the hallways.
There's questions regarding school closure and when would schools be closed, or when would we, have to shut down. And I know that there's specific guidance that we have in regards to school closures that are out there. And correct me if I'm wrong, but schools will close if the regional infection rate rises over 9% after August 1st. And then they'll close if the 7-day rolling average of the infection rate is above 9%. And then it talks about the 14-day average. And if the infection rate rises above 9%, schools must wait until the 14-day average is below 5%. So there's a lot of variables there. And again, this is information that actually is out there that the governor has put out there regarding this. And again, I hate to say, go to someplace else, but maybe we can include this information or update in the Q&A, but there's some specific guidelines that are outlined for us.
And while that's I would call the big picture state perspective on the regional piece, and I pray to God that's not the case, we have a notable or significant number of cases, we'll make the best decision, period, as a local level for our students and staff. And so because we do recognize that we're fortunate right now in this region, the numbers are very low and the state's very low. And that's why the things that we've outlined in the plan and the things that we've spoken about tonight becomes important. Because if everyone is doing their part, those numbers remain low. If people are wearing their masks not only in school but out of school, and that's the piece that I want to emphasize, while there are many people asking us what are people going to do when they're in school, it's important that people practice these same protocols when outside of schools. And I already saw it. I saw it this weekend. I ran into a parent who's saying that she's already having her young student practice wearing a mask on a regular daily basis to get accustomed to wearing a mask in school. And those are things that people should be doing, especially for some of our younger students as well. So it's not necessarily complete about what we would do when we're in school. It's all the things, all the behaviors that we reinforce from now until school open. And while school is open, that's going to help all of us be in a better situation as a school system, as a school community, as a state, as a society. And so it sounds Pollyannish in some cases, but the reality of it is because we have taken certain steps, we have seen the benefit of it, and our expectation is to continue taking those steps as we move forward as a system as well. Question about students bringing sanitizer. Yes, we expect that students will be bringing sanitizer to schools. We can't mandate and tell you must bring or you must bring a certain type, but we expect it because, quite frankly, everyone now has some type of sanitizer with them, and so that is the expectation as we move forward.
Questions about drop off and timing of the day, and I think Mr. Karen's going to be covering that.
Yeah, so just a few more questions here that I've noticed that to make sure that we're on point and we have the time, so we'll certainly look to go through those questions. The question came up about school supply lists. Those lists are largely on the website right now. And one of the things that building principals will be coming out very specific correspondences is that we will be minimizing sharing of supplies between kids. And so that will be one of those correspondences that you will get from your respective building principal and maybe even follow up from your respective child's teacher as once we finalize schedules and have those things identified in the coming weeks.
if we had to shut, flexibility with going virtual and,
So that's our plan is designed around the ability to what we call to pivot to a virtual model. If we find ourselves in a situation because of the unfortunate because of unfortunate rise in cases, our plan is designed around doing that. However, there will be challenges to offer some of the same things that we offer in person in a virtual space. And so that's always one of the things that we're mindful of, and trying to ensure that particular, say, secondary level, focus on those things that are graduation requirements first as a priority, and then complementing with other course offerings. So yes, will it be the same as when we pivoted in March? No, it'd be much more rigorous, and certainly the presentation from Dr. Wood this past week on the completely virtual learning really articulated that fact very clearly as well. So someone asked about, and I'm going to put this into the context of homework when kids are in school, in person. When they come home, do they have to then have a pile of homework? Frank, with you, we have been moving away from a lot of homework, period, and that's probably to the chagrin of some of my administrative colleagues and teacher colleagues. But certainly in this COVID situation, we are going to be very mindful of that, to not having a kid being here and then having to go home and sit for another 2 or 3 hours of homework. So that's one of those areas that we're going to be very extremely mindful about as we move forward as well. So without jeopardizing the quality of the education experience, it's one of those areas that we have to look. But it's not absolute no homework, but certainly one of those areas that we absolutely going to be mindful about in terms of what the experience of like, because Mrs. Carmen pointed out to the social emotional piece of it, and the social emotional piece of it is very real, and so even in the beginning of the school year, we're going to spend some time with the transitional pieces to make sure that the kids are really ready for not only from the protocols that we've been talking about, but in terms of mask wearing and social distancing and some of the stagger, but just from the social emotional piece of being in the school environment under different circumstances. So that's one of those things that we certainly be looking and paying close attention to as we go through the school year.
there's another question that's related to screening of visitors. For example, PTA, if they're coming in on picture day. The same expectations, once we have a screening tool, we're going to expect all visitors and contractors or people that have to be in the building for any reason to definitely screen and do a self-certify.
Yeah, and drop off of students, it will be staggered, and we'll make the adjustments to ensure that we don't have large crowds. And that's the reason why there will be designated times for parents who are going to drive their kids drop off, and times when the buses are dropping off, to avoid again having a lot of kids come at the same time at the bus port. So those are the logistics, and quite frankly, your day one is going to be different from day two, because as we see how well people follow the sequence of things, or as people get into routines, we'll make those adjustments according as well. But again, everything is premised on trying to ensure we're being as safe as possible, and we'll make the adjustments. We'll make the adjustments to improve upon the situation as we transition into the reopening, and again transition into the school year. Some ask about IEPs when therapies are usually given. The IEPs of students will be adhered to, recognizing if a child is in a completely virtual learning environment, there's certain things that we cannot effectively do virtually, and those things will be discussed with the child, parent, be it academic administrator for special ed and or the special education teacher, to figure out how can we more effectively provide those services that we can. Otherwise, if we're in person, the intent is to adhere to the stipulations of a child's IEP.
Dr. Robinson, I need to clarify because a question came up regarding the 9% average. The 9% average in regards to schools shutting down has to do with a regional.
Correct.
That's not a district. So I just want to clarify that.
Any questions, Mrs. Carmen, did you see that we haven't addressed yet?
I think, you know, two that stand out is, how are we communicating out, or when are we going to be communicating out, the individual buildings. I had referenced, for example, the nurse's office. So that was one of the questions.
So a question came up, if a child was in a room, say period 1, and a new child, that child goes to another classroom, we found out that someone in that period 1 class could have been potentially have a COVID case, and a period 2 came in. As a part of our contact tracing, we'll be looking at all those kids. And if it was period 2, we'll be looking at everything, just basically kind of draw that parameter around and saying who could have been potentially exposed, not only to that person, but to the spaces as well, to make sure that we're going through that process. But clearly, we start with those who are closest to the exposure first and work our way out as we go through the contact tracing process. Again, that will be in close coordination with and led largely by the Saratoga Health Department, which again has been very great, working with us, not only from a COVID-19 situation, but with many other health type situations that we've dealt with over the years as a school district. So if you kind of think about that, we start at the most inner circle and work our way out to make sure that we have, in fact, identified as much as possible anyone who could have been potentially in contact.
And just to add to your point, again, Johns Hopkins created a great training on contact tracing, and it really has a great diagram to show who's truly impacted. So I strongly recommend, if people have an opportunity to look at that presentation, the diagram is really helpful.
Thank you, Mrs. Carmen. Someone asked about volunteers and be it PTA volunteers on picture day. I got to tell you, as we sit here right now, a lot of those things we're going to have to look at and do differently. Recognizing that we're going to, as much as possible, try to minimize people who are coming in buildings. And I don't want people to say, oh my God, Dr. Robinson doesn't want PTA volunteers. That's not what I'm saying. I'm saying to you that a lot of those practices, such as picture day, we will be looking at evaluating those processes and say, how can those things happen? If they can happen safely, or if they can't happen at all, what's the alternative to those things as we move forward? So again, I don't want anyone to leave this call to say that we're saying absolutely out, but a lot of those practices, all those practices, we have to look at differently, because we can no longer have people coming in, because anyone coming in, any visitors to our buildings must go through a health certification pieces. And so we'll be setting up computer kiosks where people complete the certification process to make sure that there's some due diligence taking place as well. And they need to be there for official business. And one of the ones that we often see, particularly high school, child call mom and dad to bring them lunch. That's not going to happen. And unless your child is because of medical situation need a particular thing. But the point I'm making is that we need to have, and we will have, tighter controls in terms of who's coming into buildings, and having a better sense and understanding of who those people are, why they're coming, where they are, so that we can minimize exposure, which is our primary piece of it. So the first piece of it is prevention. Second part of it is mitigation. And then the third part of it is be responsive. So a lot of the things we're talking about today are the prevention type things. And then the mitigation pieces are how do we minimize the potential spread. And the response is how and what lessons that we learned from all the things that we're doing, so we can then review all those processes and do them differently as we move forward. So it is a 3 multi-pronged phase that we go through all the time with our plan and with our protocols as we look to execute as a part of reopening. Question was put on here that some local school district decided to do October. I don't know, and I'm not going to comment on why that district decided to make that decision. I can tell you here at Shen, We have been working hard on putting protocols together to have our reopening plan ready for September. As was notified last week, we'll be looking for that first week, September 8th through the 11th. Those first 4 days will be staff days and some student orientation days, with students coming back on the 14th. Would give us a chance to help transition staff back, to help some orientation pieces for our students. And then, so once we start that following week, we're ready to move forward. And if factors change, be it factors from the state or factors otherwise, we'll make the adjustments. But we are focused on putting together a highly effective and comprehensive plan for reopening in September. That was our charge, and we're focused on fulfilling that charge. I can't speak to what other school districts are doing, because some cases people just don't have capacity. I have no idea, but I can only speak to what we're doing here at Shen. And kudos to a lot of people who have put in a lot of work, and who put a lot of work now, and will continue to put a lot of work in over the course of the next several weeks to try to make reopening as seamless as possible, considering that in this COVID-19 era, many things will be different than how they were last September.
So there's some questions regarding the CIM class, and the research pieces will be done while at home, and the hands-on pieces will be done in the classroom, no in-class partners. And there may be some partnerships between a student in a class with a student at home.
So there are certain courses that will be simply done differently as a result of the nature of the course. Someone asked about New York City infection rate. I have no idea what's the protocol for New York City schools, to be quite frank with you. So I would love to answer that question, but I don't have an answer to that question.
And again, somebody talked about will high school rooms have seating charts? And again, for contact tracing purposes, we do need to have seating charts. We need to make sure that people are sitting in those particular seats. As we said, taking student attendance, making sure that we have staff signing in every day, doing their self-check. For contact tracing purposes, we need to make sure that we have that information.
So someone asked about for students, high-risk parents, again, the two options we have, in-person or CVL. And if there's a high medical risk, that's a conversation that first the parents have to make that decision for their child. And certainly if they want to consult with us, our nurses, to see if the child is coming back in person, what are those protocols? It's no different now that we have certain students in the prior, quote unquote, last year in the normal, that had high risk situations that nurses monitored very closely as well. And so those situations we would have to monitor very closely in the same way we have monitored those situations very closely in the past.
0 periods.
So right now, the 0 period model at the middle school will not occur in the same way, because we'll be looking at core courses, and more details of this will be going into. We'll have maybe 1 or 2 of the middle school principals here on Wednesday with us that talks about more of the specifics related to the middle school programming, 6th grade versus 7th, 8th. So that would be a big part of our conversation on Wednesday as well.
Yes, I believe Mrs. Barrett, who oversees that piece of it with the period 0, the DDE class, that will take place at the middle school for period 0.
Related to the seat, we'll mention it tomorrow, but also seat charts. There'll be assigned seats on buses, so we know exactly who was sitting where as well. So those are some of the nuanced differences than in the past, and you hear some of those. You're going to hear some of those transportation nuance differences. But all those things again that we're looking to do focus on our ability to prevent, to mitigate, and to respond. And so if you kind of keep thinking about those 3 things, that's the framework that we're using as we're developing a plan. How much of a prevention how does it help us to mitigate situations very quickly, and how responsive in terms of not how we respond to, but also what we learn from those situations as we move forward.
Dr. Robinson, I know you mentioned a lot about, that we may have to pivot very quickly at different times, and flexibility is really the key, and things are changing all the time. So as a system, if we end up changing to virtual, 100% virtual, some of the people who are on today are asking, is there flexibility? Because parents are going to then have to make a shift. And what if they're not there and able to help their students or their child log on?
Yeah, that is a very important question, and we have to be cognizant of that. We have to be cognizant of if we are transitioning to, if we're, again, I pray that we never be in a situation that we are compelled to transition to an all virtual model because of a high infection rate. I hope we never ever have to have that conversation. If we have to have that conversation, we have to be cognizant of the fact that parents are also working and had other situations and schedules that they have to make the adjustments for. And so we do have to think about how do we effectively do so. And quite frank with you, they were also based upon what flexibilities will be provided by the state to do certain things. What will be provided by the state the flexibility to say for children whose parents and situations doesn't allow for a young child to be home, can we have them come to a school environment and work virtually, so to speak, from school? I don't know. Those are the questions that if we're in that situation, I'm going to tell you as superintendent, we're going to look at those things very closely because we are going to try to be very cognizant of the fact that what we do as a system impacts families. What families do impact us. And so that type of reciprocal relationship becomes extremely important, particularly when we're making those significant decisions. And that's the reason why we have been trying to be very consistent with our planning, our time frame, our sequence, because we know families are making decisions. Families are making decisions surrounding daycare, making decisions around jobs. And so we can't have 1 week we're going to do this and next week we're going to do that. I think it's unfair, and quite frankly, it puts us in a situation that we can never really fine tune any particular plan. And so that's where we're right now. We're in that fine tuning phase of those plans, and I use the word nuances all the time. Recognize all those nuances and those unique situations that's unique to buildings, unique to students, unique to staff. So that we have those things identified and things that we know we can do very well, we're going to do very well. Where those pinch points are, trying to work how do we accommodate for those pinch points or try to do something else in lieu of some of those pinch points where things may not work as effectively. And so as we go through the next week and a half here, this is truly where we're going to say, when we say we can do this, it's not just can we do it some of the time, but we can do it effectively and repeatedly over time. And so that's how we're looking at our planning process. And again, I just want to preface to folks is that I respect the many questions that people have. I even respect the sarcasm that sometimes people have in their questions, because even from that we kind of draw back and say why that person think that we said it that way, and how do we make sure we deliver information differently so people can actually make a good decision. And the reality of it is, all your questions are questions because everything that we're dealing with is new. And that's why they're all questions. And everything that we're dealing with is new, and we're learning from best practices. Personally, myself, I was on a call today with some colleagues from some of the southern states who opened up this past week and asking them, how did it go? Some of my colleagues in Georgia who quite frank with you, who didn't believe in this, wearing facial covering, how did it go? And now they're making the adjustments of having kids and trying to buy PPE after the fact, where, quite frank with you, we have purchased an abundance of PPE already, because in New York, we are a state that adopted some of those things very early and trying to move forward those type things. So we're all working hard to make this plan work. And your input as parents become important. And this is why these conversations, even though it's virtual, so to speak, and in a chat, and someone asked the question, why can't we have a meeting where everyone is talking? Just imagine that if we had a meeting where we have several hundred people at the same time, that's no longer a conversation. It's certainly more effective, and we try to address the questions. In fact, I've scrolled through now from the questions that we've had, and some questions that you say, well, you didn't answer my specific questions, because in some cases, some questions were very similar, so we put them in broad categories: testing, cleaning, to try to make sure that we provide a comprehensive response to people as we move forward. A couple more questions before we conclude here. Great question was by someone that talks about people in store or wherever that wear their mask incorrectly. We see it. We see it. We see people, thinking that if I had the mask on my chin, I'm okay. That's not wearing the mask. Or if I had the mask only to my mouth and not my nose, that's not wearing the mask. We literally have a video that we'll be pushing out to parents, and some people are going to say we're being obnoxious because we're telling them things that they already know. But the reality of it is, you know what? We're not going to make any assumptions on things. We're just going to try to provide information and people use it appropriately. So yeah, we're going to talk about appropriate wearing of the mask, and even if you have to use gloves, how our staff will use those kind of things, because again, the it's not only doing it, but doing it right becomes important as well. So absolutely, I appreciate that question that someone shared with us as well. In terms of someone asked about CVL numbers, we're hoping the deadline was today, and I know that Dr. Wood and her team, they're working on CVL numbers. And in fact, I'm on a call tomorrow morning at 8:15 with elementary principals, and I think on Wednesday with secondary folks to work and look at the CVL numbers and see how they pan out by grade levels and sections, so we can try to finalize those things, because we have to start putting concrete schedules together and assignments of teachers together. All those things need to start occurring, and we're in the process now of doing those things. So hopefully by midweek we have a good handle on how does the CVL numbers impact in person and the capacity that we have to distribute staff to effectively deliver education in both of those formats. And so that's the process we're going through right now as well. And the last piece that someone asked about opting out of transportation. Um, if they still want to opt out of transportation, they can. And I would say yes, you can. Transportation is, if people don't realize, transportation at Shen is a complex machine. No pun intended using the word machine. In the normal school year, we have 204 buses that over the course of the year typically go about 2 million miles. So I'm going to put that in context. So transportation is a complex web, and kudos to Mr. Karam and his team. They've been working on trans, and tomorrow we'll be talking about transportation and food services, where we're going to talk about the drop-off times and the delivery times, and it caused the instructional day for students to be shorter, because we need a stagger in the beginning of the day, and we need some stagger at the end of the day, so the instructional day is shorter. So we're going to talk about those things and getting those dates out there. So staff day will remain the same, but the instructional day for students will be compressed, because we need to steal time, if you will, to make sure that we have the stagger in the beginning and the stagger at dismissal pieces as we move forward. So those are just some of the complications that we have to work through, and making sure that on buses that we have the appropriate social distancing, on buses and wearing a mask on buses and all those kind of things, make that a very complex one. And so we do anticipate that we'll have a larger than normal number of parents who are going to drop their children off. And that creates another dilemma for us to do, because that's why we need the numbers, right? We need the numbers not only to figure out our transportation, our busing capacity, but we need the numbers to have some sense of, okay, at a particular building, how many people do we anticipate driving? So we need to be able to stagger that sequence as well. So that's why the moving parts piece of it, the analogy, become so appropriate as we move forward. And so the opt-out numbers, the sooner we get numbers, the better for us, because we can plan both sides of that equation. People who are driving in and being able to stagger, and our buses coming in and being able to stagger. Because the last thing we want to have is everyone showing up at the same time. Because if that's the case, someone will be waiting until we create a decent stagger into buildings. And so that's not going to be the optional piece. Someone will be waiting to create a decent stagger. And again, kids having masks on the buses and wearing the mask off the buses certainly help with the ability for us to get kids moving at a nice pace into buildings. And so that mitigates some of the social distancing piece, requiring kids to wear masks on the bus, off the bus, and walking into the buildings become an absolute linchpin to the successful transition into buildings as we move forward. So with that being said, I appreciate the time that people have taken to be on this call with us. Your comments are sincerely appreciated, and I hope that people who still saying they didn't answer my questions, we tried to address all the questions that were listed here and tried to put questions in format that were so unique that we couldn't fully address your questions, but certainly give you the information so you can be an informed parent or informed member of this community or informed employee of the school district as well. So there's a lot of work going into this, and we every day, folks, every day, I have to tell you, there isn't a single day, and I'm not talking about Monday through Friday, Saturday and Sunday. This is a 18-hour day odyssey for myself personally that we are focused on trying to understand what's coming out of Pike, and how do we make adjustments accordingly as well. And if you just read the newspaper this weekend, we were meeting as superintendent's group to respond to a local school district that made a change because we had to figure out what does that mean for us. And so I share that not to have people sympathize, but for people to understand that we truly do have the best interests of every student, every employee in mind. And we're simply asking people to help us because safety of our students, safety of our staff is truly everyone's responsibility. So thank you for joining us this afternoon.